Professor Sujatha N from IIT Madras. Professor Sujatha received a bachelor's degree in electrical and electronics engineering from Calicut University, India, and her doctoral degree in biophotonics from NTU, Singapore. She joined IIT Madras in the year 2006 and is currently associated as Professor of Biomedical Engineering in Department of Applied Mechanics. Her research interest is in developing clinically viable optical tools for tissue assessment, which include design of experiments, implementation, calibration, and clinical trials. Let's welcome Dr. Sujatha.
Thank you, Subiksha, for the introduction. I'm very happy to see you all as part of the organizing committee. Without further introduction, I'll just directly go to the topic, I think, because of the time limitation. So Asima just mentioned about the concept of optical biopsy and what were the status of biophotonics then and now, and Jayashree actually took over. And she was explaining to you about liquid biopsy. And I would like to talk about how optics can be used for a completely non-invasive diagnostics and what are the challenges and how we can do about it. I think I'm a newbie here in that list of groups that Asiba was talking about. I think we are the latest one. Okay. So agenda for today's presentation is I'll just give you a very brief overview of medical diagnostics because I'm from the biomedical engineering department. I'm as Subiksha told, electrical engineer doing biophotonics and joined biomedical group in applied mechanics. So basically it is a integration. So whoever is doing research in biomedical engineering, you need to integrate all concepts of engineering or science. It's very much essential because our body is like that. We have lots of systems inside. So you need to have an understanding of all mechanical, electrical, chemical, all these things to be integrated, to think even to pose a solution to a biomedical problem. So we'll do the diagnostics and overview, then non-invasive diagnostics. What is optical biopsy doing for non-invasive diagnostics and what are the challenges and what are the future directions? Okay, I'll start with one question. Who does the medical diagnostics? Technologist? Normally, if you have an illness, whom you go to? Not pathologist, it's a doctor, right? It's a doctor, simple answer. But sometimes patients can also diagnose. Nowadays, that's the trend. So if you do like this will be the fate. You can Google your symptoms and then get diagnosed your disease, and you can go all the way wrong. So, but machines, Google can essentially help diagnosis, not in this way, but it has got a lot of AI, ML kind of thing. A lot of things are coming into the medical diagnostics right now to help clinicians to develop intelligent detection systems or diagnostic systems, and that's what we are going to talk about now. Now, how medical diagnostics at the entry level happens? You have description by the patient, checking for inflammation, data on the body mass index, body temperature, heart beating rhythm. He puts the stethoscope and finds it out, checking blood pressure. That's the entry level. So whomever you are going to with what kind of illness, this is the first step that you are going to do. And the doctor, if he is an experienced person, he can sense some abnormality in you and he can give you a preliminary kind of some capsules or medicines. You go back, we'll ask you to come back after 2 days. If it is not succeeded, he will ask for detailed diagnosis. So what is this detailed diagnosis? We have lots of, to extract this detailed diagnosis, we have actually lots of signals which is coming out from your body. Whereas electrical signals from the body will help when attached to ECG, EMG, EEG kind of, and coupled with MEG. These electrical and magnetic signals can actually give a lot of information about our health status. And when you go to the thermal signals, essentially the infrared radiation from our body. Basically, thermograms are there to look at how hot or cold your body is. Basically, it is used as a tool for cancer diagnosis. X-rays, essentially, you know, right? Because it is for imaging bony structures. Computer tomography is an extended version of X-ray. You can have very, very sensitive pictures. Magnetic resonance imaging will look at how much water content your body has. Again, related to cancer. Positron emission tomography is again looking for radioactive substance will be injected, and depending on how much gamma rays they are emitting, the cancer cells will retain those, normal cells will flush them out. So you can actually look at these things. Endoscopy is another thing. You push the endoscope through a body cavities and you can look at tumors. And all these things, if you look at these things, right from the thermograms, X-rays, CT, MRI, PET, and endoscopy, they use electromagnetic spectrum in one way or another. So that means essentially all of them are optics, only in the different wavelength spectrum. Now ultrasound is actually again something different because we use sound waves. I don't want to talk about it more. So if you look at the first category, these are endogenous thing. That means the body gives out signals on its own. They are called as endogenous. And these things are exogenous. That means you have an external source to poke the response from the body. That's true with X-ray, CT, MRI. But these are all non-invasive imaging techniques. You don't have to take out anything from the tissue. You don't have to poke the tissue. Everything is non-invasive. But people are actually not, the doctors are not actually convinced with whatever results that they have. For confirmatory test, disease confirmation, they normally do for a blood test, saliva, sputum, urine, fecal matter. They will ask you to extract and they do a biochemical analysis. And then finally, they also do a tissue, certain conditions, they do a tissue histopathology using optical microscopy. So the challenges associated with the histopathology is that solid tissue biopsy is what I would like to talk about today. The examination of cells removed from the living body to discover the presence, cause and extent of the disease. The workflow is you have to remove, you have to prepare the tissue. I have just few pictures here. This is the tissue removed. You have to process it a lot. You have to embed the tissue in wax and you have to actually slice it through a microtome. You have to put it in a glass slide, stain it. A lot of processes are involved in this till the pathologist can look at it and see whether the shape and the concentration of the cell has increased or not to make a confirmatory diagnosis. So the nature is invasive, it's risky, costly and time consuming and painful. So what does optics can do here? Optics can do a lot of things and that basically helps the development of optical biopsy techniques. See, actually the optical biopsy is an oxymoron. That means biopsy is basically something you are taking it out. Optical biopsy, you don't have to take anything out of the tissue. Now, if you compare this, standard biopsy is invasive. It's not a real time. It requires bulk instrumentation. It involves excise samples, huge processing steps, limited information, and prone to sampling errors. But still, the gold standard is biopsy because we are yet to replace the gold standard by the optical techniques. But optical biopsies are non-invasive, can be made completely non-invasive, near real time. It can be made portable. It is in vivo. Just like that, I can show it and basically get information from that. No tissue processing and additional information such as microvascularity or maybe deeper blood flow can be obtained with minimal sampling errors. So what are the modes of optical biopsy? So I have just briefly categorized into three. One is optical spectral analysis. Diffuse reflectance, fluorescence, Raman and diffuse correlation spectroscopy will come under this. And you have optical interferometric techniques, OCT, electronics, speckle pattern interferometry, laser speckle contrast imaging, LDF, everything will come under optical interferometry. And optical polarimetry, as Asima told, we have Muller matrix imaging to look at. So what information we are looking at? So all these spectral analysis, you can have tissue biochemistry and tissue microcirculation. And in this category, you can have tissue morphology, which is the cross-sectional imaging, tumor localization with ESVI, and tissue perfusion with LSCI and LDF. Optical polarimetry will go on a little bit more detailed level, 2 minutes, yeah. You will have at cellular level, you can basically do this. So I would like to just give one example of how to assess the microcirculation, because I think biochemistry, Jayashree and Professor Asima has already told about how do you assess microcirculation using optical techniques. So So this is the circulation we all know about. The heart pumps out blood and various ups and downs. You have lots of arteries, veins, etc. What is microcirculation is the capillary network. It's extremely important to convey the nutrients to the cells and also take the waste products back from the cell to the whichever pathway, kidneys or any other systems to expel. So how do you assess this optically? Why do you assess this? Because many of the diseases are associated with changes in microcirculation. And it's a very complex process to study how microcirculation is affected. And if you can optically, completely non-invasively look at the microcirculation, basically you can make an assessment, non-invasive assessment of this. So the phenomenon is like this. You have light. Basically we use laser. And when this is a skin cross section, when it is going down, then you have capillary network. It will interact with the RBCs, which is flowing. And the flowing RBCs basically gives out, the microcirculation is predominant when you look at a pattern which is called as a speckle. Any laser radiation which actually is shown on a rough surface is a speckle pattern. This is actually a speckle pattern. So speckle contrast, if you look at, you can assess microcirculation. If you look at the source frequency shift, you can assess, which is the Doppler phenomenon, you can assess microcirculation. You can look at changes in intensity correlation over a time with a given STS. For example, if you have given location, source detector one position, source fiber one position and detector fiber another position, continuously looking at the intensity correlation between these two over time, you can actually assess the microcirculation. So I have taken, I'll quickly go through, one more minute. Diabetes, type-II diabetes. You have to first understand, I think Anita will elaborate more on that. Any problem that you basically need to study or investigate upon, the first thing that you have to look at, you have to understand the pathology completely and whether optics is a solution for that or not. So for everything, optics is not a solution. So for diabetes, you know, the glucose measurement kit is basically the gold standard. But we were actually looking at it as just a case study, whether microcirculation changes are also associated with it. Basically, how can you assess? So what we have done, this is a very simple setup. Laser again shown into the skin surface and just captured by CCD camera plus zoom lens, and you get a fluctuating speckle pattern. If it's a dynamic, it's fluctuating, otherwise it's static. And just look at the contrast, which is sigma, standard deviation by mean intensity, is going to give you a beautiful picture which basically gives you the tissue perfusion. So when you do this in the foot sole of diabetic patients, normal would look like this, pre-diabetic would look like this, neuropathy would look like this. These are advanced stages of diabetes, and ulcer would look like this. That means showing this is very easy because a lot of image processing involved in you have to eliminate the scattering, static scattering, everything out of it, so that you get only the dynamic component from that. So this is one speckled phenomenon. Just capture it, process it, and then you are there. The second one is the shift in the frequency. That means this is also a very convenient thing to use. This is a Doppler probe which is attached to the foot of a patient, and then you get a continuous perfusion signal. So it's based upon the shift in the source frequency. When there is a moving phenomenon, the return light has a shifted frequency as compared to the source frequency. So what we did is we took the optical perfusion, blood perfusion signal, and we fragmented them to get different frequency components. And to our surprise, we can see that we saw that we can extract cardiac, metabolic, myogenic, neurogenic, all components are actually hidden in this particular perfusion. So you can basically extract them out. So sort of explaining why speckle contrast was changing with the perfusion. So one step deeper you can do. The last one on my slide is whether we can make it disease or patient specific. So as I told you, when I show the light here and basically collect the light from here, is affected by the scattering and absorption of this tissue, apart from the underlying blood flow. So if you can separate the absorption coefficient and scattering coefficient and quantify them, as well as quantify the blood flow as well, then you can actually make disease specific models. Many diseases requires both. So we are currently working on developing this, already done. We are on the clinical translation stage where we can do the diffuse correlation spectroscopy combined with diffuse reflectance spectroscopy to analyze the entire optical properties of the tissue plus the blood flow. So this is just an example I would like to, this is not a very gold standard for diabetes, just to show you an example I have taken, but cancer diagnosis, there are so many diseases where such kind of initiatives will find a lot of applications. With that, I will just hand it over to Professor Anita to elaborate more on the clinical aspects of it. Thank you very much.
Thank you, Dr. Sujatha.